They called her just a nurse. Crisp scrubs. Night shift. Competent enough. They didn't know her hands had held organs together under fire. They didn't know the green beret unit patch was sewn inside her jacket lining, pressed against her ribs every single shift, waiting. And they had no idea what would happen when the man she'd come here to save finally woke up and spoke her operational call sign in front of everyone. Cedar Creek Medical's long-term coma ward smells like antiseptic and resignation, fluorescent lights buzzing overhead with the steady hum of machines that measure out time in beeps and oxygen saturation numbers. Megan O'Brien moves between the 12 beds in the darkness of 2,300 hours, her footsteps muffled on linoleum worn smooth by 3 years of her own quiet footfalls. The night shift suits her. Fewer witnesses. Fewer questions. She checks vitals on bed 7 with a gentleness that contradicts the calluses mapping her palms like topographic lines, scars from sutures, from tourniquets, from the kind of medicine practiced with a combat knife instead of a scalpel. Colonel James Hayes. 3 years in pharmaceutical twilight after an IED strike in Sanjin Valley, Helmand Province. 214 days of ventilator cycles. 1,812 hours of monitored silence. She doesn't look at his face when she works, professional distance, nothing more, but her eyes track every line on the monitors with the precision of someone reading a language nobody else in this hospital seems to speak. His EEG patterns, the subtle variations in his pupillary responses, the way his left hand sometimes clenches in a rhythm that matches nothing in the medical literature but feels like something to her. She adjusts his pillow and her fingers brush the edge of the mattress where a fabric edge catches. Inside her jacket, the one she keeps locked in her locker, the one with the unit patch sewn into the lining, she can feel it pressing against her ribs. Valkyrie 6. That's who she is when the sun goes down and the hospital empties. That's who she was in Helmand Province when she performed a field thoracotomy on a green beret who wouldn't stop bleeding, her hands moving on instinct, on 18 years of training that had nothing to do with civilian nursing credentials. The chart in her hands tells a different story. RN Captain. Night shift rotation. No military background listed. No operational history. No call signs. She maintains her composure through the contradiction the same way she maintains it through everything, by focusing on the next task, the next breath, the next observation. The fluorescent lights flicker. Someone's phone buzzes down the corridor. She notes the colonel's core temperature, the slight elevation that registered as a decimal point of nothing on the previous shift's charts but registers as something to her. 3 years of doctors had looked at these numbers and seen only the slow fade. She looks at them and sees patterns. She sees a mind that hasn't checked out entirely, just waiting. Waiting for what, she doesn't let herself consider. Dr. Pierce arrives for morning rounds early, which is how he manages everything, with strategic superiority and the kind of timing that announces importance. He stops at the glass partition of the coma ward and watches her through it, his presence like a hand turning down the volume on the room. Megan doesn't feel his eyes yet, too focused on the colonel's chart, her finger tracing the EEG patterns like she's reading a language that requires hands to understand. She's been a civilian nurse for 6 months. 6 months of lying, of documenting her deference, of asking permission instead of giving orders. 6 months of watching decisions made by people who've never held a life together with improvised supplies and a prayer. Pierce steps into the ward at 06 for 7 hours, his white coat moving like a flag of jurisdiction, his loafers clicking against the tile with the rhythm of authority. He's studying the charts already before he reaches her station, his jaw set in the way men's jaws set when they're preparing to correct someone. Megan straightens without appearing to hurry, her hands moving to rest at her sides, the posture of someone who understands the hierarchy even if she resents it. The standing orders for bed 7, he says. Not a greeting. Not a question. He doesn't look at her yet, still reading, still performing. Are you implementing them as written? Yes, doctor. Her voice comes out soft, controlled, the voice of a night shift nurse who knows her place. The voice of someone who is not Captain Megan O'Brien. All medications on schedule. Respiratory settings per protocol. Routine repositioning every 2 hours. Pierce finally looks at her and his eyes are the color of something expensive and cold, like the kind of watch he's wearing on his wrist, a $12,000 Omega Seamaster, she notes without meaning to, the observer's eye that catalogs details for later. He studies her face the way someone studies a document they expect to find an error in. The EEG readings, he says. You're noting them correctly. Baseline activity consistent with previous measurements. She keeps her hands visible, professional, empty. No seizure activity. No significant change in cortical function. He's expecting her to defer more, she can tell. Expects her to hedge, to apologize for noticing things, to act like someone viewing these patterns for the first time instead of someone who's spent 3 years reading the language Colonel Hayes's unconscious brain is still trying to speak. But she doesn't defer further. She simply states the facts. Pierce's jaw tightens almost imperceptibly. A full second of silence passes between them, long enough to hear the ventilator's mechanical wheeze, long enough for him to realize she's not going to volunteer additional uncertainty. We've covered this ground, he says, voice dropping half a tone. These assessments are standardized. They don't require interpretation. A good nurse documents, she doesn't their eyes. Megan meets his eyes for exactly as long as it takes to show she heard him, then looks back at the chart. This is the critical moment, the one where she either accepts the boundary or crosses it. She chooses the narrow path between them, holding her composure like she's holding a live grenade. I understand, doctor. He doesn't believe her. She can see it in the way he holds the moment longer than necessary, searching for something in her face that will confirm his suspicion that she's problem material. But he won't find it. She's worn this mask for too long, in too many hospitals, in too many countries where one wrong word could get someone killed. Pierce turns away toward the next bed, his white coat settling around him like an assertion of control. Megan exhales once, slowly, and returns to the colonel's monitors. Her eyes catch on a small fluctuation in his heart rate, a pattern shift that lasted maybe 6 seconds, something that would appear as nothing in the data stream but registers like a door opening just a crack. The next 6 hours pass like every night shift passes, in small accumulations of routine, in the quiet work of keeping machines fed with power, of checking the chemistry of blood that hasn't moved in 36 months, of reading the slow alphabet of an unconscious man's vitals. She documents everything with precision, writes nothing that could be questioned, maintains the boundary between observation and interpretation with the steadiness of someone who understands what's at stake. At 0812 hours, she notes a change in the colonel's right-hand position. Nothing dramatic. Subtle. The kind of thing a family member might miss, that a doctor scanning the room wouldn't catch, that only someone watching with the focus of a sniper counting his breathing would register. The hand has moved slightly, the fingers in a configuration that mirrors. She stops herself. She doesn't write it down. She photographs it in her memory instead, the way soldiers learn to hold images. Around 1030 hours, transport brings in a trauma admit from a GSW incident on Peachtree Street, a stabbing actually, a medical supply delivery driver who got caught in a street fight and had a wound dehiscent starting, the sutured edges separating from stress and poor aftercare. Megan's hands move before her mind finishes the assessment. Her fingers know the suture technique before her eyes finish reading the wound, field suturing, the kind that holds tissue under field conditions when sterile supplies are theoretical and time is measured in seconds. The transport medic, a guy with the carriage of someone who's seen combat zones, whose eyes carry that particular absence that comes from having watched people die, he locks eyes with her when she's already 5 stitches in. His face goes very still. Recognition flashing between them like they're transmitting on frequencies nobody else can hear. Her hands don't stop moving. The needle goes in, comes out, goes in again with the kind of muscle memory that doesn't come from nursing school. The medic watches her for maybe 7 more seconds, then he looks away, but they both know something has shifted. He's seen this technique. He knows what it means. He knows what she is. The wound closes. She clips the final suture with trauma shears that have weight to them, the kind of weight that comes from being used where equipment gets tested against human need instead of standards compliance. The medic wheels the patient toward the admitting bay and doesn't look back at her, but the air around them both feels charged, like something dormant has been activated. She cleans her hands at the sink and feels the unit patch through her scrubs, through the jacket locked safely in her locker 2 floors down. Captain Megan O'Brien. Operative Valkyrie 6. Night shift nurse at Cedar Creek Medical. All of it true. All of it a lie. All of it necessary. Dr. Pierce is somewhere in this building, filing his observations about the nurse who thinks too much and questions protocols designed by better minds than hers. He's already begun the slow work of managing her, of creating a record of her minor insubordinations, of preparing the institutional framework that will eventually require her removal. He has no idea what's already in motion. He doesn't know that the kernel is beginning to surface, that the patterns she's been documenting are the vocabulary of a man trying to claw his way back to consciousness. He doesn't know that recognition just passed between her and a combat medic on the transport shift, that the secure compartment of her operational identity just acquired a witness who won't ask questions but definitely knows. She returns to bed 7 and checks his pupils with the focused attention of someone conducting an examination that matters more than routine. Colonel Hayes doesn't wake. Not yet. But something has shifted. Something has changed. The room held its breath. 17 residents lined the back wall of the conference room during grand rounds Thursday morning, their white coats crisp and eager, their pens poised over notepads they'd fill with Dr. Pierce's wisdom. For attendings stood near the windows, their posture the practiced relaxation of people who'd stopped being impressed by anything years ago. The fluorescent lights hummed their constant drone overhead as Dr. Pierce held up a tablet, Megan's tablet, her charting, her documentation, and smiled the way a conductor smiles before dropping the baton. Here we have Nurse O'Brien's creative interpretation of neurological assessment, he said, his voice cutting through the room like a scalpel finding the exact nerve. He turned the tablet so the residents could see. She's documented what she calls responsive patterns in Colonel Hayes. Notice the terminology here, purposeful hand movements, she writes. Tactical positioning of the digits. He paused, letting the smirk build on his face like a sunrise nobody asked for. The Colonel has been in a persistent vegetative state for exactly 3 years. 3 years since the IED strike in Helmand Province. And yet somehow, our night shift nurse has detected patterns that every neurologist, every specialist, every actual clinician in this hospital has somehow missed. The residents shifted. A few exchanged glances. Pierce turned to face them fully now, the tablet lowered but still visible, still damning. This, he continued, his voice dropping to the tone of a disappointed father, is what happens when staff confuse television medicine with actual clinical judgment. When someone watches too many episodes of House and starts thinking gut feelings constitute a neurological assessment. The Colonel isn't responding. The Colonel is exhibiting normal reflex arcs that families misinterpret as consciousness every single day. He looked directly at Megan now, his eyes meeting hers for 3 seconds, 3 seconds long enough for the entire room to turn and stare. Some of us have spent decades learning to distinguish between hope and evidence. Others apparently get their medical education from primetime drama. Megan stood against the far wall, near the door she'd entered through, her tablet held against her chest like armor. Her jaw locked. Her fingers had gone white around the edges of the device, so tight her knuckles looked like they might tear through the skin. She said nothing. Her stare was flat, colorless, the kind of stare that comes from somewhere very deep and very cold. She watched Pierce smile at his own joke, watched the residents laugh, nervous laughter, the kind that comes from understanding they were watching someone get dismantled in real time, and she did not move. Did not flinch. Did not lower her eyes. Pierce turned back to the whiteboard, marker in hand, ready to move on to the next topic. The moment passed like a stone sinking. By the time he'd written the next patient's name, no one remembered she was still there at all. 2 days later, the hallway near the vending machines was empty at 11:51 p.m. Megan had calculated it that way during her previous 3 shifts. 11:56 was when the ER residents rotated to trauma simulation labs, when the attendings were in the physician's lounge reviewing discharge summaries, when the corridor between the main ward and the break room belonged to nobody. She'd needed coffee. She'd pressed her credit card into the machine and was watching the plastic cup drop when she heard voices, male voices, multiple, approaching from the east corridor. Pierce and 4 other physicians she recognized from grand rounds. They were laughing before they saw her. One of them was Dr. Kwon from neurology, another was Dr. Salzer from internal medicine. They stopped at the vending machines beside hers, reaching past her for their own selections, their conversation continuing unbroken. "The night nurse who thinks she's Gregory Howe's," Pierce was saying, his voice pitched to carry, his body angled so the other physicians could see his face, his expression, that half smile that said he was performing and he knew he had an audience. "Next she'll be ordering lumbar punctures based on her gut feelings. Maybe throw in a liver biopsy while she's at it, really make the attending rounds interesting." Dr. Salzer laughed, a sharp, barking sound that echoed off the tile. "At least House went to medical school." "Barely," another voice added. Megan didn't look to see who. Pierce was riding the momentum now, the way men with power do, building on the laughter like a musician reading the crowd. "I'm documenting everything she touches in that coma ward. At some point, someone's going to notice that the only thing more dangerous than false hope is a nurse convinced she's a diagnostician." The coffee cup finished brewing. The hiss of the dispenser cut through his words. Megan could have left then. Could have taken her coffee and walked past them, invisible, silent, the way she'd been trained to be invisible. Instead, she stepped closer to the machine where Pierce stood reaching for his own cup. She didn't speak. Didn't announce herself. Just appeared at his elbow, suddenly present, suddenly there in a way that made him pause mid-reach. The physician stopped talking. The silence stretched like taffy. Pierce turned to look at her, and for a moment she saw surprise cross his face, just a flicker, the involuntary response of a man who hadn't expected the target of his jokes to materialize in front of him. Then his expression hardened again, shifted into something defensive, trying to look amused. Megan's voice, when it came, was quiet. Not whispered, not apologetic. Just quiet the way a knife is quiet. The way a predator is quiet. The difference between confidence and competence, Dr. Pierce, is that one needs an audience, she said. She let him see her eyes fully for the first time since grand rounds, that same flat stare, that same colorless gaze that could belong to someone who'd seen things beyond what most people can process. "You might want to remember that." Then she turned and walked. Not away from him, through the space where he stood, forcing him to step back or make contact. She didn't look at Kwon or Salzer or the others. Didn't acknowledge their existence. Just walked back toward the ward, her coffee in hand, her cardigan with the faded unit patch sewn inside the lining pressed against her ribs, her heartbeat normal, her breathing even, her face a mask of perfect professional indifference. Behind her, the physicians dispersed without meeting each other's eyes. Pierce's mouth worked soundlessly for 4 seconds. Then he turned back to the vending machine and pressed buttons at random until a bag of pretzels fell into the dispenser tray with a crinkle and a thud. That afternoon, Pierce appeared at the nurse's station with 2 security officers. He came during shift change, when the maximum number of staff would be present, when witnesses would be abundant. His voice was pitched to carry across the entire ward. "Ms. O'Brien, your documentation practices are under formal review," he announced. His tone was professional now, surgical, the voice of a man using institutional power like a weapon. "Your charting on Colonel Hayes contains notation inconsistent with established protocols. Neurological assessment is not a skill acquired through night shift observation. One more documentation of responsive patterns, one more creative interpretation, and you will be escorted from this building and placed on a performance improvement plan that will effectively end your career in nursing at Cedar Creek Medical and every other hospital in Fulton County." He let the threat hang. Let it settle like sediment in the water. Let every nurse, every tech, every aide on the ward absorb it fully. Then he turned and walked back toward his office, the security officers flanking him like guards, like this was already decided, already won. Megan continued charting. Her pen didn't pause. Her hand didn't shake. But inside her chest, she felt something shift, not fear, not doubt, but acknowledgement. The game had changed. What had started as professional disagreement had become something else. Something darker. Something personal. Because Dr. Pierce had discovered that humiliation wasn't going to break her, so now he was going to try isolation instead. Within 7 days, the systematic nature of his campaign became visible. Every experienced tech assigned to night shift was mysteriously reassigned to days. Megan's rotation changed twice in 5 days, Tuesday to Thursday, then Thursday to Sunday, then Sunday to Wednesday. Each modification cut her off from the core nursing team, separated her from the collaborative shifts where information flowed and support existed. She found herself working with new hires, with agency staff, with people who didn't know the hospital's systems or the colonel's history or her methods. She overheard Pierce on the phone through his office door on a Wednesday evening, his voice low but distinct through the gap. Yes, liability concerns, specifically related to overly independent practice decisions in the Coma ward. I'm documenting everything, building a case. Yes, I understand the protocol. No, nothing reportable to nursing yet, just positioning, planting seeds with the department heads. The conversation ended. The door remained closed. Megan continued her rounds. 3 days later, during a routine patient transfer, a young man in hospital transport blues helped wheel a stretcher toward the elevator. His name tag said Torres. His bicep carried the faded tattoo of a combat medic's insignia, the rod of Asclepius with a combat knife running through it. She'd seen that tattoo on maybe 20 other people in her life, and all of them had served. He glanced through the window into the Coma ward as they passed. Megan was there, gloved up, working on a patient whose post-surgical wound had spontaneously dehisced, the incision had split open, tissue exposed, blood seeping through the bandage. Megan was already past panic, already past protocol. She'd sterilized the area, already gloved, and she was speed suturing with three-handed technique, her movements precise and efficient, no wasted motion, the kind of suturing you learn when there's incoming fire and the next helicopter isn't arriving for 6 minutes. Torres stopped mid-step. His hand tightened on the stretcher rail. That technique wasn't taught in hospital schools. That technique was born in dust storms and mortar fire and the understanding that you might be the only person standing between someone's life and someone's death for the next hour. She looked up. She saw him seeing her. For 3 seconds, maybe 4, they locked eyes through the glass, mutual recognition, the understanding that passes between people who've stood in the same kind of fire. Then Torres nodded once, slow and deliberate, the way soldiers nod, the way you acknowledge someone's service without speaking a word. He looked away and kept pushing the stretcher toward the elevator. That night, alone in the supply closet, Megan's hands trembled as she texted her handler. Not fear. Not emotion. Just the physical response of muscle memory recognizing exposure. The response came in 17 seconds. She deleted both messages and sat in the darkness of the supply closet for 2 minutes, breathing steady, processing, compartmentalizing. Then she stood and returned to the ward, where Colonel Hayes lay in his bed, his monitors showing the same flat lines they'd shown for exactly 3 years, his hands occasionally moving in patterns no one but Megan recognized as something other than random reflex. The night shift staff roster pinned above the supply cabinet told the story in erasure. 3 names crossed out. Carlene, who'd worked the colonel's bed for 2 years and knew his breathing patterns like a second language. Marcus, the night tech who could change a patient's linens without waking them. Dishon, who understood drains and catheters and the 1,000 small rituals that kept a 3-year coma patient from rotting from the inside out. All 3 reassigned to day shift effective immediately. The message was surgical in its precision. Dr. Pierce wasn't yelling anymore. He was organizing. Megan read the notice on her second shift back after the vending machine incident. Her jaw clenched once, then released. She'd survived worse organizational restructuring in the field. In Helmand Province, personnel rotations meant 3 of your 5-man team could be killed between breakfast and lunch. This was paperwork. She folded the notice and continued her pre-shift walkthrough of the ward. Replacing Carlene, Marcus, and Dishon were 3 newly hired technicians, Trevor, Jasmine, and Kyle, all hired within the last 4 weeks, all still learning where the supply closets were, all still asking questions about protocols that experienced staff would never need to ask. None of them had touched the colonel's care sheet more than twice. None of them understood that his left shoulder had a range of motion limitation that required specific positioning every 3 hours or his lungs would develop atelectasis. None of them had learned yet that his body temperature ran 0.7 degrees lower than normal and that charting it as abnormal was how you got unnecessary interventions triggered in his chart. Pierce had done this deliberately. Megan recognized the strategy because she'd seen it deployed in briefing rooms across Fort Bragg by officers who wanted to destabilize a unit without direct confrontation. You didn't fire the competent people. You reassigned them. You created knowledge gaps. You ensured that only one person, the person you were targeting, possessed the institutional memory required to do the job correctly. On her second night with a new crew, Megan found Jasmine attempting to reposition the colonel's Foley catheter without understanding the difference between movement that helped circulation and movement that could cause urinary tract infection in a patient who couldn't report symptoms. Megan redirected her hands gently. Neutral alignment. His bladder sits lower than you think. Jasmine nodded gratefully and Megan felt the weight of it, the dependency, the knowledge transfer that should have happened naturally through experienced staff, now falling to the one person Pierce had isolated. The schedule rotation came next. Megan's nights shifted from 19:00 to 07:00 with overlapping coverage to 21:00 to 05:00, the graveyard window when the census dropped, when the nursing station emptied, when documentation happened in silence. No day shift nurses to consult. No evening supervisor making rounds. No attending physicians rounding at 11 p.m. like they did on Monday and Wednesday nights. Just Megan, 3 new technicians who didn't know their patient, and a unit designed for minimal oversight. The intercom above the colonel's bed crackled and wheezed with the sound of the hospital waking down around her. Footsteps echoed in the hallway less frequently. The fluorescent lights overhead hummed their monotone song. By 2 o'clock, the entire wing felt like a tomb with a heartbeat. She maintained her composure through each indignity because the mission required it. Her real purpose wasn't to work night shift at a civilian hospital. Her real purpose was to sit 60 feet from a Green Beret who'd been unconscious for 3 years, watching him the way a hunter watches a ridgeline at dawn, not for obvious movement, but for the small shift in light that meant something was about to change. The classified operations briefing tucked into her boot mentioned 3 things Colonel Hayes had witnessed before the IED detonated in Sanjin Valley: a weapons cache location, an intelligence officer's identity, and the coordinates of a black site facility that existed in no official records. Hayes had been unconscious ever since. But unconscious wasn't the same as brain dead. And the Pentagon had sent Megan to Cedar Creek Medical specifically because Hayes sometimes moved his hands. Not like Caesar's. Not like the random reflex contractions that comatose patients developed after years of immobility. Like he was trying to say something. Night 63 came on a Tuesday with rain hammering the parking lot like applause, the sound traveling through the walls and becoming part of the ambient noise of the ward. Megan sat in the chair beside the colonel's bed during her 2:30 documentation break, filling out charts on her laptop, when she noticed it. His right hand. 3 fingers contracting. Pause. 2 fingers. Pause. Index finger extended, held for 3 seconds, then released. She stopped typing. The pattern repeated 7 minutes later. 3 fingers. Pause. 2 fingers. Pause. Index. Her pulse accelerated but her breathing remained steady. Muscle memory. This was the field training response they drilled into her during the behavioral medicine component of her military nursing certification: control your autonomic response while your neural system processes critical information. In other words, don't let your body give away that your mind just received the thing you've been waiting for. She watched for an hour. The pattern repeated every 11 minutes, consistent as clockwork, precise as a metronome. Not random. Not seizure activity. Not the involuntary muscle firing that characterized 3 years of immobility. She retrieved her trauma shears from her pocket, the ones with the engraved call sign on the handle that no one at Cedar Creek Medical would ever understand, and used the blunt end to gently touch the colonel's palm. His fingers contracted again. Right on schedule. Then she moved to the computer and opened a blank incident report. Her fingers flew across the keyboard with the speed of someone who'd spent 13 years documenting medical events in environments where accuracy meant the difference between court-martial and commendation. She charted each contraction. She noted the timing. She referenced the medical literature on locked-in syndrome, on minimally conscious states, on the persistence of motor function in patients with profound brain injury. She documented the possibility, however remote, however theoretically unsound, that the patient was exhibiting purposeful movement. Then she did the thing that would destroy her. She cross-referenced it to the field manual she kept in a laminated pocket inside her hospital laptop bag. Breach formation. Enemy left flank. Hold position. 3 combat hand signals from the 75th Ranger Regiment's tactical vocabulary, the same signals she'd trained on at Fort Moore in Georgia, the same signals that Colonel Hayes would have trained on in his career as a Green Beret attached to Joint Special Operations Command. He wasn't seizing. He was speaking in the language they both understood. She filled 4 pages. She cited medical literature. She built a case so meticulous, so irrefutable, that anyone with a functioning prefrontal cortex would have to consider that the comatose colonel was attempting conscious communication. Then she filed the report to the system and began the process of routing it upward through hospital administration toward the intelligence channels where it belonged. It was 3:41 when she sent the first secure message to her handler. It was 4:22 when Dr. Pierce's badge scanned the front entrance to the unit. Megan's body registered the intrusion before her conscious mind did. The hitch in her breathing. The slight tightening across her shoulders. She forced her lungs to expand, 5-count inhale, 7-count exhale, the combat breathing technique that kept fear on a tether. Pierce never came to the unit before dawn. He never reviewed charts before his official shift. There was only one explanation for his early arrival, and it walked beside him in the form of the night administrator and 2 security guards whose radios crackled with the static of the prepared and waiting. He moved directly to the nurse's station. He didn't look at Megan. He pulled up the charting system on the desktop computer and his face underwent a transformation, the careful professional composure draining away like blood from a wound, leaving raw fury in its place. Ms. O'Brien. His voice didn't raise. That was the worst part. When Pierce's voice didn't raise, it meant he'd crossed into a territory where volume wasn't necessary because institutional authority would do the work. Step over here, please. Megan stood. Her hands remained at her sides. Her face remained neutral. The voice inside her skull, the one trained in behavioral intelligence, in reading the room, in understanding the predatory calculation of a man who'd just realized his target had documented something he couldn't suppress through administrative pressure alone, screamed warnings. But she moved toward him with the calm of someone who'd walked into hostile territory hundreds of times and understood that panic killed more people than bullets. These entries, Pierce said, pointing at the screen. His finger trembled with the effort of controlling whatever emotional cascade was happening behind his ribs. These are fabrications. Completely unsupported by clinical reality. Documentation of observed movement, Megan said. Her voice came out steady. Not apologetic. Not defensive. Simple statement of fact. You've invented patterns to cover your incompetence. To suggest that you've somehow discovered something in 3 years that every board-certified neurologist in this hospital missed. This is grossly inappropriate. It's falsification of medical records, which is a felony, and it's grounds for immediate termination. He turned to the administrator, who was already nodding, already buying the narrative that Megan was the problem. Contact HR, get her badge deactivated as of now. And call our legal team, we'll need documentation of these fraudulent entries for the State Medical Board. The security guard stepped into position on either side of Megan. Not touching. Not threatening. Just standing there in their dark uniforms with their hands on their belts and the quiet confidence of men who'd never been told no by a nurse in a hospital gown. The patterns are repeating, Megan said. Every 11 minutes. You can verify the timing yourself if you watch the patient for 60 minutes. I don't need to watch anything. Pierce's composure was fracturing now, the cracks spreading across his face like a dropped windshield. What I need is for you to understand that you've crossed a line that can't be uncrossed. You've. The colonel's monitors erupted. The flatline alarm screamed through the ward with the kind of urgency that turned every other sound into irrelevance. Not a gradual decline. Not a slow drift into crisis. A catastrophic, immediate failure of oxygenation that turned the baseline of the monitor into a flat, terrible line of white light against black background. His oxygen, Megan said, and she was moving, not toward the guards, not toward Pierce, toward the colonel's bed, toward the ventilator alarm that was shrieking its warning of disconnection or failure or the million small catastrophes that could kill a patient in 30 seconds. His crashing. Code blue, Pierce snapped, muscle memory overriding his fury. Page respiratory. Page critical care. Megan reached the colonel's bedside and her hands moved on their own, the way hands moved when they'd practiced responses 10,000 times, when crisis was just another version of protocol wearing a different mask. The ventilator circuit. The oxygen saturation reading. 68% and dropping. The 4-line still patent. The monitors showing the electrical silence of cardiac arrest. Crash cart, she called, and one of the new technicians, Kyle, was already moving toward it, the kid understanding through pure institutional instinct that something catastrophic was happening even if he didn't understand the pathophysiology. The pulse check came back negative. No carotid pulse. No femoral pulse. 60 seconds of lost perfusion already, maybe more. His lungs weren't oxygenating and his heart wasn't beating and she was beginning chest compressions before the crash cart arrived, her hands positioned on the sternum, the heels of her palms driving down with the kind of force that required not thinking about broken ribs or fractured sternums, just the simple calculation that dead people couldn't be harmed further. Compression, compression, compression. The rhythm took over. Push hard, push fast. 30 compressions. Check airway. Ventilate twice. 30 more compressions. The crash team arrived in a tide of noise and expertise and she stepped back, her hands falling away from the colonel's chest, her oxygen saturation work complete and the hospital's official code response mechanisms taking over. The resident was shouting orders. The respiratory therapist had the patient's airway. The pharmacist was drawing up epinephrine for what should have been the final push before calling time of death. But Megan had seen something in the monitor rhythm before stepping back. Not a shockable rhythm. But not nothing either. Not the complete absence of electrical activity that characterized true asystole. Something that flickered, something that suggested the heart hadn't entirely surrendered to the arrest. Push epi, the resident said. The pharmacist injected the medication into the 4-line that Kyle held steady, his young face carved from stone, not panicking, just doing the next right thing because that was all anyone could do when someone was dying in front of you. 45 seconds of compressions. Check rhythm, the resident called. The monitor showed something other than flatline. A brief flutter. Just enough electrical activity to suggest that somewhere in the colonel's arrested chest, his heart was considering the possibility of recovery. Resume compressions. Megan stood against the wall beside the supply cabinet, her hands hanging at her sides, her chest rising and falling with the methodical calm of someone who'd just completed a sprint and was already moving to the next tactical position. She could feel Pierce's stare from across the room, could sense his mind calculating how this cardiac arrest affected his narrative of her incompetence, could read the calculation on his face as clearly as if he'd spoken it aloud. The patient crashes during the exact moment he's firing her, during the exact moment he's accusing her of fabrication. During the exact moment her documentation of purposeful movement becomes either evidence of her incompetence or evidence of something that required explanation beyond administrative discipline. The monitors bleeped again. Another flutter. Stronger this time. Weak perfusing rhythm, the resident called. Get me a blood pressure. The nurse began cycling the automated blood pressure cuff. The numbers climbed slowly. 52/31. Still in the danger zone. Still barely enough to sustain consciousness if the brain could sustain anything at all. But climbing. "Let's get him to ICU," the resident said. "Move." The crash team mobilized with practiced efficiency. The bed detached from its moorings. The ventilator moved with them. The monitors converted to portable units, and the patient began his journey upward to the intensive care unit, where people with catastrophic cardiac events got the kind of monitoring that the medical surgical ward couldn't provide. Megan watched him go. She didn't move. She didn't speak. She stood against the supply cabinet with her hands at her sides and her face empty of everything except the 1,000 small calculations running beneath the surface. The resident passed her on the way out, their eyes meeting for half a second. Something flickered across his face: confusion, recognition, the dawning realization that the nurse standing in the wreckage of the code had done something extraordinary and he wasn't entirely sure what. Then he was gone, trailing his team up the corridor, and Megan was alone in the ward with Dr. Pierce, who stood beside the now empty hospital bed, his face a landscape of confusion and rage and something that looked uncomfortably like fear. "You're done here," Pierce said quietly. "Your badge is deactivated as of now. Security will escort you to your locker." The guards moved forward. Megan didn't resist. She let them walk her out of the ward, out of the unit, down the corridor toward the employee entrance, while the rain continued to hammer the parking lot like applause for something neither of them yet understood had just changed entirely. The colonel's hand moved again at 2:33 a.m. Not the random muscle spasm that had defined 3 years of unconsciousness, but a deliberate sequence. Tap. Tap tap. Pause. Tap tap tap. Megan stood frozen at the bedside, her pen suspended over the chart. She knew this pattern. She'd learned it in Helmand Province, 18 months into her first deployment, when a Green Beret sergeant taught her combat hand signals in case comms went down during field ops. The sequence meant only one thing: ready to extract. Her hands moved on their own, documenting everything. Timestamp. Duration of the signal, 14 seconds. The exact pressure of his fingers against the bed rail, as if he were modulating force deliberately rather than thrashing unconsciously. She photographed the positioning with her phone, angle and distance calculated to professional standards, then cross-referenced the pattern against 3 years of prior charting. Nothing. No doctor had noted anything resembling deliberate movement. No attending had bothered to look closer than persistent vegetative state and the insurance codes that came with it. The next 8 nights, she documented 7 more signal sequences. Each one different. Each one meaningful. Complex enough that they couldn't be explained away as random neural firing. They were patterns. Communications. The colonel, 3 years into a coma that apparently wasn't, using the only language he had left to speak. Megan recognized a third signal on night 11, 2-finger tap, sustained pressure, release, and her chest tightened. That one meant contact. That meant he knew someone was there. That meant he'd been aware, alone in the darkness, for 1,095 days. She created a detailed report, cross-referenced against tactical nomenclature from her own service. 50 pages of clinical observation written in medical language but carrying military weight underneath every word. She titled it Neurological Response Pattern Suggestive of Deliberate Motor Control in Extended Comatose Patient, careful to use only terms that would survive peer review. The document sat encrypted on her personal laptop, waiting for her handler's secured channel. She needed to route it through proper intelligence channels before it entered Cedar Creek Medical's official record. She needed to. Dr. Pierce's voice cut through the ward at 4:33 a.m. like a blade finding its target. "My office. Now." Megan looked up from the computer terminal where she'd been documenting vitals. Pierce stood in the doorway with 2 hospital administrators flanking him like sentries, their faces arranged in expressions of bureaucratic concern. Behind them, a security officer stood with his hand resting on his belt. Not on the radio yet. But close. She didn't hesitate. Hesitation would confirm guilt in his eyes. She saved the document, cleared the terminal, and followed him down the corridor. The fluorescent lights hummed overhead with their endless, indifferent song. Her badge felt heavy against her sternum, proof of identity that was about to become irrelevant. Pierce's office was small, sterile, decorated with his credentials on the wall: residency from Johns Hopkins, fellowship from Mayo, a photograph of him shaking hands with someone Megan didn't recognize but whose significance was clear from the framed placement. The administrators took the chairs across from his desk. Pierce sat with Megan standing, a power positioning so deliberate it bordered on theatrical. "You've been documenting false observations," Pierce began, his voice carrying the certainty of a man who'd already decided the outcome. "Fabricating data in an attempt to cover prior charting errors that would have exposed your incompetence." Megan didn't speak. She'd learned in Hellman that silence was more powerful than denial. Pierce slid her printed pages across the desk. Her own detailed reports, hand-marked with his red pen. "This patient has been stable for 3 years. No change in neurological status. No cognitive function. No indication of meaningful consciousness. And yet suddenly, in the past 2 weeks, your charting shows, what? Voluntary hand movements. Intentional signaling." He looked at the administrators. "I would call this either fabrication or a psychological break." One administrator, a woman with gray hair and the careful expression of someone trained in liability, cleared her throat. "Ms. O'Brien, these observations are inconsistent with every prior assessment. Can you explain the discrepancy?" Megan met her gaze. "The patient is showing patterns of deliberate motor control. The data supports." "The data supports nothing," Pierce interrupted, his voice rising slightly, that edge of frustration creeping in. He'd expected compliance. He'd expected fear. What he was getting instead was measured clinical language. "This patient is a vegetable. A 3-year-old brain injury with no recovery trajectory. What you're documenting is pattern seeking in a data set that contains nothing but noise." The second administrator, male, younger, with a phone-conscious posture of someone always aware of litigation risk, leaned forward. "The concern here is patient safety. If staff are misinterpreting medical data, especially regarding a high-profile long-term care case, the hospital's exposure is significant." There it was. The real threat. Not patient care. Liability. The colonel wasn't a human being in their calculus, he was a line item on a balance sheet that had somehow become complicated. "I documented what I observed," Megan said carefully, each word placed like a surgical instrument. "The data is accurate." Pierce's jaw tightened. For a moment, she could see the war playing out behind his eyes, the strategic calculation that his direct approach wasn't working. He set down his pen with deliberate precision. "Your access to that patient is revoked, effective immediately. All future charting goes through myself or Dr. Harrison. You will not make rounds on the long-term care ward. You will not deviate from standard protocol. And if I find one more fabricated observation in this hospital system..." The phone on Pierce's desk buzzed. A call from the ward. He ignored it, but the interruption hung in the air like a held breath. Somewhere in the back of the hospital, the colonel's monitors were trying to tell someone something. The phone buzzed again. Pierce silenced it. "As I was saying, if I find..." The ward's emergency alert system activated. 3 distinct tones, the cardiac rhythm that meant code. All 4 of them heard it. The administrators exchanged a look. Pierce's expression hardened into something that might have been satisfaction, timing, again, on his side. Megan was already moving before her conscious mind caught up. She passed Pierce's desk like it contained nothing relevant to the next 60 seconds. Muscle memory took over. Her legs carried her toward the stairwell, down the corridor, toward the sound of the code alarm still ringing its electronic urgency. The ward was chaos organized only by the muscle memory of crisis. A resident Megan had never seen before was bagging the colonel, his technique loose and panicked. The telemetry monitor showed a rhythm that looked like spaghetti, irregular, chaotic, the kind of electrical storm that meant a heart trying to die. A nurse was already pushing the crash cart toward the bedside. Someone had called for the defibrillator. Pulmonary embolism, another nurse called out, her eyes locked on the monitor. Came out of nowhere. 1 minute normal sinus, next minute. Megan shoved past Pierce, who'd entered behind her, his mouth already opening to reclaim authority over the situation. She reached the bedside in 3 strides. The colonel's chest was heaving with the squeezed artificial breaths from the bag valve mask. His pupils were blown. His skin had taken on that grey-white tone that came when peripheral circulation shut down in shock. She didn't ask permission. She didn't defer. She took the mask from the resident's hands, firm enough that he released it without conscious decision, and fit the seal herself with the precision of someone who'd done this in a moving Humvee under fire, in a dusty aid station with rounds cracking overhead. The bag inflated with a hiss. His chest rose. Good oxygenation. His oxygen sat was starting to climb already. Move, she said to the resident, not unkindly. You're done here. The crash cart arrived. Megan was already positioning her hands on the colonel's chest, feeling for the landmarks, second intercostal space, mid-clavicular line, the exact spot where his ribs would shatter if she got the compression depth right. She started compressions with force calibrated by muscle memory. Deeper than civilian protocol. Faster. The rhythm of resuscitation in austere environments, where every compression had to matter because there might not be a next one. 1, 2, 3. 30 compressions, each one driving her entire body weight through her hands, through the colonel's sternum, into his arrested heart. She counted in Arabic, the language of Helmand, the rhythm that had kept her steady in a forward aid station while a green beret bled out under her hand 6 years ago. That patient had survived. That muscle memory had been earned in blood. Stop, Pierce was saying. Stop, that's incorrect protocol. 30 compressions. She didn't break rhythm. The defibrillator pads were being placed. Good. Charged to 200 joules, a lower setting that the resident questioned, his eyes flicking toward Pierce, but Megan had already moved to call the clear. Clear, she announced, and the room backed away. The defibrillator discharged with its distinctive sound, electricity arcing through the colonel's system in an attempt to reset his heart's electrical rhythm. His body convulsed, that involuntary jerk that civilians found disturbing and soldiers recognized as the sound of a restart attempt. The monitor showed something different. Still abnormal, but the spaghetti pattern was resolving. The electrical chaos was organizing into something the heart could use. Compressions again. 1, 2, 3. The resident moved to take over, but she shook her head once, sharply, and he stepped back. Her hands were calibrated. She knew the pressure. 60 compressions. 90 seconds. The monitor showed a rhythm catching, and then sinus. Regular. Normal. The heart had accepted the electrical shock and returned to organized beating. She maintained the compressions through 2 more cycles, felt the colonel's chest rise and fall with new purpose, felt the faint flutter of a pulse under her fingers when she checked at the carotid. Present. Strong. The kind of pulse that meant a human being was still occupying this body. The resident was reaching for her hands now, ready to take over, and she released him, stepping back as the monitors stabilized into normal rhythms. The colonel's oxygen sat was 94% and climbing. His blood pressure was coming up. He was back. The room erupted in the controlled chaos of postcode protocol. Someone was calling for a cardiology consult. Someone else was preparing medication. The ventilator was being connected, the colonel's breathing transitioned from handbagging to mechanical precision. And Dr. Pierce was speaking, his voice steady and surgical and final. Ms. O'Brien, your shift is over. She turned to look at him, and in that single moment of eye contact, she saw him understanding exactly what had just happened. Not that she'd saved the colonel, but that she'd done it in front of witnesses. That she'd demonstrated a level of medical competency that contradicted every narrative he'd constructed about her incompetence. Your badge is deactivated effective immediately, Pierce continued, each word placed like a piece on a strategic board. Security will escort you from the building. Your employment is terminated for emotional instability, gross violation of protocol, and physical interference with attending physician authority during a code. His voice carried that certain tone of a man who'd already rehearsed this moment. Hospital counsel will contact you regarding the investigation. The security officer was already moving. Megan didn't resist. She let them walk her from the ward, past residents who'd seen her save a life and were now seeing her removed from the building. The corridor seemed to extend forever. The fluorescent lights overhead flickered in that way that fluorescent lights do, indifferent to human drama. Her feet move because feet move. Her body followed the security officer because bodies follow. The stairwell door opened. Her hand on the railing was steady. The parking lot was dark, the rain still falling in those big Georgia drops that came in summer. She stood in the rain, still in her scrubs, the name badge already pulled from her collar by security before they left her in the employee lot. Her phone buzzed at 5:17 a.m. with a text from an encrypted number, * mission compromised. Extraction denied. Cover must hold. *. She read the message 3 times, as if additional readings might change the content. They didn't. Cover must hold. Which meant she couldn't disappear. Couldn't fly out on a military transport. Couldn't become someone else. She had to stay in place and maintain the fiction of being a civilian nurse who'd just destroyed her own career. The drive home took 14 minutes. The house was dark except for the kitchen light she'd left on, the automatic habit of a person who lived with fears. She sat at the kitchen table in her wet scrubs, hair dripping rain onto the hardwood floor, and didn't move. At 3:14 a.m., her 8-year-old daughter appeared in the doorway, small and confused in her pajamas, and asked in a voice that belonged to a child who had already learned that the world was less safe than the stories claimed, "Mommy, why are you home when it's still dark outside?" Megan pulled her daughter close, breathed in the clean smell of her daughter's hair, and found that the tears came anyway, silent and unstoppable, because she had just saved the man she was sent to protect and lost everything doing it. An hour after security walked her out of Cedar Creek Medical, Megan's phone vibrated in her jacket pocket. The text came from a number that didn't exist on any carrier's network, routed through servers she'd never ask about, mission compromised. The rain came harder. She sat motionless, still wearing her scrubs because she hadn't had time to change, watching Cedar Creek's emergency entrance where ambulances came and went like clockwork, carrying broken people toward healing she was no longer allowed to provide. The practical part of her mind, the captain part, the operator part, began running scenarios. Her clearance was blown. Her cover was exposed. The mission she'd been placed inside Cedar Creek to execute had just become impossible. Colonel Hayes was still in that building, still in his coma, and she'd documented patterns nobody else had seen, but now nobody would look at her documentation because Pierce had made sure she was the kind of person whose observations got dismissed as emotional instability. She'd lost her position. She'd lost her access. She'd very nearly lost her mind in that moment, sitting in the dark with rain on the windshield and the weight of 3 years of silent operation collapsing around her shoulders like a roof caving in. It was past 3 in the morning when she got home to the small house in Decatur, the one rented under a civilian identity with civilian money, maintained by a civilian routine that was never supposed to crack. She'd spent the drive back thinking about how to explain this to her daughter, knowing that children always sense the difference between the stories adults tell and the truths they're hiding. She found Emma sitting at the kitchen table in pajamas printed with cartoon stars, a glass of milk in front of her, small feet not quite touching the floor. The overhead light was harsh and clinical. Emma's eyes were wide and confused in the way children's eyes get when the world doesn't make sense and they're too young to pretend it does. "Mommy." Emma's voice was small. Fragile. "Why are you home when it's still dark outside?" Megan couldn't answer. She pulled her daughter close and the tears came then, silent and unstoppable, soaking into Emma's hair while her daughter's small arms wrapped around her neck and held tight because children understand that sometimes grown-ups break, even the strong ones, especially the strong ones. Emma didn't ask questions after that. She just held on. The next morning brought Federal Bureau of Investigation agents to Cedar Creek Medical, but not for Megan. At 8:16 a.m., 3 days after her termination, Dr. Pierce sat in his corner office on the 4th floor, unaware that his career had already ended, that the digital footprints he'd left behind when he tried to alter Megan's personnel file at 3:42 a.m. were already flagged, already logged, already escalating through chains of command that would make him disappear into the federal system like a stone into black water. He'd spent the last 40 minutes committing felonies with the precision of a surgeon, fabricating incident reports, forging timestamps, trying to build a paper trail that would explain why he'd terminated a decorated military officer on grounds of emotional instability. Every keystroke saved. Every deletion preserved. Every forgery timestamped and monitored by Cedar Creek's audit system, the same system installed 3 years earlier after the Medicare fraud scandal that cost 2 administrators their licenses and 3 years in minimum security prison. The FBI Cyber Division caught his modifications in real time. Field agents rolled within 27 minutes. The moment came at 9:14 a.m., during shift change, when most of the hospital staff was concentrated in the corridors near the main ICU. 2 agents in dark suits walked into Dr. Pierce's office without knocking, closed the door, and emerged with him 3 minutes later. He was already protesting, his voice rising in pitch, insisting there had been a mistake, that he was merely attempting to protect Cedar Creek from liability, that everything he'd done was in the hospital's best interest. The agents didn't respond. They simply walked him past the vending machines where he'd held court, where residents scattered like prey animals sensing a predator, past the nurse's station where Megan's coffee mug still sat untouched on the counter, next to a small potted succulent someone had left as a gesture of solidarity during her exile. Megan stood at that nurse's station, her badge reactivated and hanging from her neck, her personnel file amended to reflect what she actually was, Captain Megan O'Brien, U.S. Army Medical Corps, on assignment through a classified liaison agreement that the hospital's legal team would spend the next 6 months trying to understand. She didn't move as they walked Pierce past. She didn't speak. She simply met his eyes with that same flat, cold stare she'd given him by the vending machines 3 days earlier, the one that had made him redden with rage because he'd understood in that moment that she was not the person he'd been playing with. The look in her eyes now said something else entirely. It said, "I survived things that would destroy you. I was trained by people harder than you could ever be. I smiled and took your insults and documented your crimes while you thought you were winning because I have a mission and you were never anything but a distraction from it." Pierce saw the understanding dawn on his face, like watching someone fall, like watching gravity finally catch up with something that had been pretending to fly. His mouth opened. Nothing came out. The agents guided him toward their vehicle while hospital security moved into his office behind them, boxing up his files, his degrees, his framed photograph of his sailboat, erasing him from the building's memory with the efficiency of people who'd done this before. 6 months later, the rain had stopped and Atlanta sat under a clear blue sky, the color of promises nobody was keeping. Megan walked her daughter through Cedar Creek's main entrance, Emma small and excited in a navy dress, holding her mother's hand with the grip of a child who'd learned that some things in life were worth holding onto. They were here for the commemoration ceremony, the one the hospital's new administration had organized to try and repair what Pierce had broken, to acknowledge the quiet veiler that had been hiding in their hallways while they looked the other way. Through the glass doors of the loading dock, Megan saw him. Dr. Pierce, wearing an orange safety vest that said Gateway Contracting on the back, mechanically unloading boxes of specimen cups from a medical supply van. The contractor that employed him specialized in second chances for people who'd served time, which meant Pierce had spent the last 4 months in federal prison waiting for trial, would spend the next 4 years in minimum security, and would eventually emerge into a world that had already moved on without him. He saw her and froze. He looked away. She felt nothing but the weight of her daughter's hand in hers as they continued past him into the main atrium. The plaque was bronze and newly mounted on the wall where the main hallway met the ICU corridor, in honor of Captain Megan O'Brien, U.S. Army Medical Corps, whose dedication to her patients exemplifies the finest traditions of military and civilian medicine. Colonel Hayes stood beside it in his dress uniform, his posture straight, his eyes clear. 3 years in a coma and 8 months of aggressive physical therapy had rebuilt him into something close to whole, close enough that he could stand and salute and remember what it meant to be a soldier who'd been brought back from the edge. He nodded once when he saw Megan, not a greeting, not a thank you, but a soldier's recognition of another soldier who'd completed the mission despite everything. The hospital's new CEO offered apologies that sounded rehearsed. The Marine Corps general who'd read her citation 6 months earlier returned to deliver remarks about the intersection of military service and civilian duty. The hospital board issued statements about new oversight procedures and policy implementations. Megan listened politely while her attention stayed on Emma, who read the plaque with wide eyes, finally beginning to understand that her mother was not just a nurse who worked nights, that the quiet woman who made breakfast and helped with homework was something else entirely, something formed in deserts and carried home in silence. As they left the ceremony, Colonel Hayes walked them toward the parking lot. He placed one hand gently on Emma's shoulder and told her, "Your mom saved my life twice. Once in Afghanistan. Once in this hospital. She's the bravest person I know." Emma's face transformed into something incandescent with pride. She gripped her mother's hand tighter. Driving home, Megan passed the loading dock one final time. Pierce stood there in his safety vest, mechanically unloading boxes, moving through his new life with the hollow precision of someone who'd already understood the cost of hubris. She reached down, touched the faded unit patch sewn inside her jacket lining, no longer hidden, no longer a secret, finally pinned openly over her heart where it belonged. Emma dozed in the passenger seat, still wearing her navy dress, still carrying the glow of finally understanding that the woman beside her had been a warrior all along. Sometimes the bravest warriors carry stethoscopes, not guns. Subscribe to see more stories of the heroes walking among us.